I am delighted to be here today to talk about NIH's remarkable journey to leverage 21st century technology advances, accelerate biomedical research discoveries, and improve health. Let me start by telling you a little bit about NIH. Our $35 billion annual budget supports science research by 300,000 researchers at 2,500 academic institutions and medical centers located all around the United States and around the world, including at our research labs on our campus in nearby Bethesda, Maryland. We focus on everything from the most basic science about how life works to conducting clinical trials and translating that research to create new treatments and cures. Recent advances we are seeing through technology-enabled research are nothing short of amazing. Today, we're generating vast amounts of biomedical research data, and it's more than doubling every year. In fact, the cost of sequencing a human genome has plunged to less than $1,000. That is 3 million times less expensive than the first completed human genome just 15 short years ago. These technology advances have led to the rise of new data domains at just unprecedented size and scale. Genomics and other types of omic data, electronic health record data, imaging data such as brain and chest scans, environmental data, and even personal devices like my Fitbit, the one I'm wearing to track my exercise. This data deluge has led to many new big data research programs where we're seeing tremendous opportunities for discovery. But there are challenges. Research data are siloed, and they're often difficult for researchers to find or use. We have to figure out better, more cost-effective ways to sustain these high-value data research components. And we must always protect the privacy and security of your health data. We're investing a lot of effort to address these challenges, but make no mistake, the ability to harness and learn from data in unprecedented ways, coupled with these new technologies, are literally changing the way we do science. And we know we can only achieve the kind of advances we need through partnerships. We cannot do this alone. Last year, NIH launched the STRIDES initiative as part of our first ever strategic data science plan. STRIDES is a set of new partnerships with industry partners to harness the power of cloud computing to provide NIH researchers access to the most advanced computational infrastructure, tools, and services. AWS joined our STRIDES initiative as a partner in October of 2018 and is helping us by providing scalable storage, elastic computing resources, advanced tools for data preparation and analysis such as machine learning and artificial intelligence, training programs, an important component on how researchers can use the AWS platform for health research, and safeguards to secure and protect the privacy of your data. Data that we make available through the cloud will be fair, findable, accessible, interoperable, and reusable to support researchers with all levels of expertise, from the citizen scientist to the bioinformatic science researcher. Through these partnerships and investments in big data, we believe we can vastly accelerate cures and treatments for everyone. I'd like to mention just a few of the exciting big data research programs NIH has underway. As a soon-to-be first-time grandmother, I am proud that NIH funds $4 billion in pediatric research each year to improve the lives of our most important resource, our children. Did you know that 1 in 33 infants born in the United States has a birth defect? And in 2017, more than 15,000 new cases of cancer were diagnosed among children. One of our important pediatric programs, Kids First, is developing large-scale data resource infrastructure with support from AWS to help researchers around the world understand new insights into both the biology of childhood cancer and structural defects. These capabilities are allowing us to work at a very large scale to develop new analytic frameworks and to provide cloud-based workspaces to enable researchers to work collaboratively, empowering research for the health and well-being of our children and grandchildren. The second program is our Cancer Moonshot. While overall cancer death rates have been declining over the last few years, living with cancer is still a reality for millions of people in our country. We must do more. The Cancer Moonshot program is ambitious. We're trying to accelerate cancer research to achieve a decade's worth of discovery and progress in just 5 years. One of the key initiatives in this program is to build a national data ecosystem to enable researchers to learn more about how tumors evolve, to be able to better predict treatment outcomes, and to help address what are often debilitating patient symptoms and side effects of cancer treatments. And we appreciate the important role that AWS has played in enabling this computational infrastructure for cancer research. The third program is the BRAIN Initiative, which is set up to revolutionize our understanding of the human brain and how it works, enabling us to better diagnose, treat, cure, and even prevent diseases and disorders affecting more than 100 million Americans each year. Things like depression, Parkinson's, and Alzheimer's. Alzheimer's is personal for me. Every 66 seconds, someone in the United States is diagnosed with this disease. My mother was one of those people. This is a moment in science when our knowledge base, our new technology capabilities, our dedicated and coordinated efforts can generate great leaps forward, giving scientists the tools they need to better understand how we think, how we learn, and how we remember. And finally, the All of Us program. The All of Us program is one of the most ambitious research efforts our nation has ever undertaken. We aim to collect a massive amount of individual health data from 1 million participants across the United States. This is quite a departure from the one-size-fits-all healthcare, and it also represents the hope for all of us to come together to help change the future. Our goal is to uncover paths towards delivering precision medicine based on your health characteristics, your life experiences, and your genetic profile. Participation is open to everyone, and we have more than 200,000 people signed up already. I encourage you to sign up. Help fight disease and improve the health for you, your family, your friends, and future generations to come. To put it simply, our partnerships with AWS and many of the organizations that you represent here enable our researchers to focus their efforts on what they do best, applying their best scientific expertise and methods to make critically new discoveries and breakthroughs in health. If we are to speed advances, we must transform the way we conduct research, the way we share results, and the way we get discoveries into patient care. And in this way, with help from AWS and industry partners, we believe we can make great strides to accelerate discovery now and in the future. Thank you.